practitioners we can use after the article prayer process. Okay. Actually, this is not a sharp one, but when you got injury and there will be hitting, there will be getting chance of injury. And my friend, he got all the last 1 year back 7 stitches he did. We need energy to practice for those things, and to practice Marma chikitse, you also need energy. So you have to do the yoga and walking and exercises for your extremities, so that your spine will be strengthened. This is one of our students. She got stiffness, and in KFC college we did Dr. Jiten take this video, and the patient is not able to turn right side as well as left side. Just examine. And I did the stimulation and the manipulation. Our traditional Marma techniques what we applied in this patient. Examination. This is the article prayer. I teach you everyone. Okay? So you get right instead of taking videos and photos. Then next day, today night or tomorrow morning, if you are getting patient, without any doubt you can practice. So if there is a nerve impingement of the severity is more, you can tell the person, 2 persons are the both sides, they can do the traction. Along with the traction, you can do the stimulation. Immediately after this manipulation, patient is able to turn. If it is not able to turn, then your diagnosis is wrong. Okay, you can go for the MRI, X-ray, like that. So without X-ray and MRI, you can do all those things in the OPD level. And the information is more. In the Kavastan, you can use the Marmani, Lepa with this one. You can heat it and apply over the all this Marma. And after that, patient is
Facebook Live.
Okay. This is another video. You can see this completely turn one side. Morning stiffness you will get. With the canal stenosis and the spinal canal compression, all those things that will not work out. Okay, you can do as a Upashaya and Anupashaya also. You can do the stimulation, all this condition. In the cancerous condition, even after the manipulation, stimulation pain will not reduce. But you can do all this patient extra, especially in the stiffness, in the morning stiffness. You have to examine thoroughly where the patient is having pain, especially the pain is radiating to the hand. Initially, it will be C5, C6, C6, C7 areas. So you have to palpate the posterior lateral area. I kept my 2 fingers on the posterior lateral area. This is long back 2015 I taken this. And this one, patient is turning right side as well as left side. Okay. Without any difficulty. So I came to know there is no need of further investigation. We can go for the stimulation and manipulation. This is a technique I am using by hand. You can by practicing. You can use your elbow in the front side and the back side you can use another hand. Otherwise you will not get stability. Amsa Balaga Brahadi Marma. After Marma manipulation and stimulation, you can go for the Marma massage. So for that, you should know the exact location of Marma. I think you are expert in the theory part, and anyway you will refresh the location wise. And this is highly practical. 2 days before I got one patient, and even after morning stimulation and manipulation I did, I given LABA one medicine also. After LABA also, patient lie down in the broad position, again pain started. So you should apply a LABA or whatever it is, Vedana. Don't go for any vigorous massage. Just do the application of stimulation and application of oil, and you can apply the LABA. Then tell the patient lie down in the sitting position or lie down in the supine position. Patient should not lie down on the broad position. Okay. After that, patient was okay. Then I told my brother, you just apply the Sneha Svedana. Then he told, I'm alright. He gives to 25 ml or 50 ml of oil. I will apply in my home. So you think about, you want to run your clinic, and this one, and patient also should get relief. If you are doing Sneha Svedana, patient also will get relief. Okay, so you think twice before doing all the Marma technique. That much strength is there in the Marma. Okay, and coming to that, and I will do this, I will move past this slides and everything, and the location I will give more importance, okay? This another history is there. I will tell you after this. This one. This is the Kantas here. There are 8 Marmas. This is the Neela. This is the Neela Marma. We can pack it in your body. Okay. There is no other hesitation if you are doing like this. No. So once you are expert in that, next day you can practice. Okay. This is the Neela. Okay. And this is the Manya. This is the Manya Marma. I think the feeling you might have noticed that the people are hitting this by using this. This is the Manya Marma. Okay. And another one is Neela and Manya. And Matraga is just above the thyroid. This is the Matraga. Neela and Manya. Neela, a carotid artery and jugular vein. And this Matraga is this area. And about this Matraga, this is the branches of the common carotid artery 1 to 6 in the jugular veins. And I want to tell you before going for the regarding Marma. And here, I think 1 month back, we have 3 branches hospital in Calicut district 2 is there, and more than 45 years my father started that Kucheri hospital is there. We have father had so many shishyas in the Kalani and Kalani Marma Chikitse. So one of my father shishyas, a neighbor, and this one child is means this friends, just they are playing, and he ordered this neck region. So if he is folding means someone is folding here, you just fold your neck. If you have down, what will do? Whether person will come front or whether person will move back. Person will try to move back. Okay. So if someone is falling, we can't hold by taking this hand to hold other particular any other extremities. He ordered make it tight. What happened? It little bit pain, and he went after 1 hour. He went home, and in the evening his father taken to allopathic doctor. Here and any allopathic doctor is there? No. No. Okay. No, if it is there also, I can tell because there are allopathic doctor told, okay, nothing is there structural wise. When the patient is okay, then you can go to your home. This paracetamol syrup or any other given, and he said, after 2 hours, he started difficulty for breathing and hiccup, severe hiccup. In the Kalani Marma also explained very nicely. This is the time to which Marma is explained. It's just if you are holding here, and there will be stiffness of the neck, it will move to one side. And another point, there will be severe hiccup. Okay? So my father's sister came to know this is injury to the Marma. He started chewing off this one, Shundi, in severe blowing, with the pressure, blowing over the Adipati Marma, and he kept his hand over here. Then above the hand, he made it tapping. That is Attengal protocol. So within 2 minutes, he came to normal. Then he told, even if it is normal also, we just meet our guru. So around 2 hour journey is there from Kucheri to our hospital. 11:45, 12 o'clock they came our hospital. My father told me just to see. Still difficult is there body. That patient was okay. I did this tapping. Then from above downwards, I did massage. All these near marmas. So just examine thoroughly, and you have to see the lectures and do the tapping over the mother. So if thing is happened here means this opposite side we have to do the tapping. That is Marma Attengal protocol. Bringing back into abnormal condition into normal condition. So if you know this knowledge, you can do any type of injury in your home, especially in the head region, in the chest region, all those things I demonstrated here, because this is needed in everything practice. So if after that we can give the labor bandage, we treat in our hospital, this labor and bandage, no need of going for any snehana swekana. If any abhidhana, if any not only in the Marmasthana, other sthanas also any injuries happen, it may be Marmasthana or any other area, you should not keep any more combination. You should not go for any massage. You should keep only cold application. You can keep cold labor, and after that you can keep the bandas also, pain and swimming is there. That's why our Acharya explains to Sutrasthana 18th chapter, when Abhibhirikavento Vedana Upashanti, Asaprasana Bhava, pain is reduces immediately after putting bandages. Even after stimulation, manipulation, the pain and swimming is there, you can keep the bandas. Okay. And another history in the Kirgadi Marma and head is coming to say Adhipati Marma that I will tell you. Regarding Marma, the history so much is there. I will not tell the stories because if I am telling more, I need minimum 1 or 2 days for explaining the particular Marmas. Okay, and I will tell you one history. When I was doing my PG in Mysore, JSS, just outside there will be, if I am telling the story will be there in our mind. If I am telling the slides and everything, you may forget. So patient go out, epilepsy. Then everyone is giving some keys and everything. Then they are pouring water and everything. Patient is not able to come to normal. So then they started. One person is frying the bhaji. Here also bhaji is famous. Bhaji is frying, and this big rod was using, and almost only half part is remaining, other part is completely dipped in the hot oil. Suddenly the iron rod was not there, so one person was asking, you just give your iron rod. Then he given also, he told, I will not give. Then he started to give his person. Then I told, don't give, I am doctor, I will take care. So patient growth is coming, completely this attack is there. No? I made this patient to the lateral position, I kept my hand here, I teach you how to do this regarding Marma stimulation. With that one, patient came down. So many exams. During bandaging time also patient may get faint. We do immediately stimulation. After Siravada also patient may get faint. We do regarding Marma stimulation. During driving also you are getting. So if you are getting sleep when you can drive here regarding Marma stimulation. I teach you how to do. Within 1 or minute, you get a lack of oxygen saturation is there. It will be alright. Okay. And the pathology is there. Then you have to correct. This is the strength of regarding Marma. Okay, Marma, the sinusitis usually they will be there. You can keep our finger here and you can do the stimulation. This is a Marma. And Abaga means this is the side of this finger. Abaga Marma. Sinusitis, especially we are keeping hand here and pressing. Okay, I teach you everything this session practice. And Avarta Marma. In insomnia case, you can do the stimulation. This is the Savani, this is the Avarta Marma. In the middle of this eyeglass, this area you can do stimulation like this. This is the Avarta Marma stimulation in the insomnia condition especially. Avarta Marma and Shankha Marma. And Shankha Marma is this area. Whenever you are feeling headache, we used to hold like this. Okay? Without any proper knowledge, the people will hold the head. And Shankha Marma, Ukshepa Marma, 2 fingers in the this one ischemic condition of the paralysis here, and we can do not in the hemorrhagic condition. We can do the stimulation over the Ukshepa, 2 fingers above this area. This is the Ukshepa Marma. Just understand the location so that it will be easy to do the stimulation. And Stabili Marma, this is the Stabili Marma. The people they are keeping the Rakta Chandana or Chandana, normal Chandana here to reduce the heat. Siramama, Simandama, or Simanda Sada. Whenever we are getting angry, and what we will do, we keep our hand, then we just fuse like this. Okay? So this is a Simandama. Sringara Marma, Adhipati Marma. From here, keeping your hand, it will reach here. This is Adhipati Marma. We can do stimulation in the Parkinson's paralysis, and whenever the head reaches Abhigada, after that also you can do stimulation over the Adhipati. During the application of Pachuradi or Rasani Shiravela, we can apply the Marma stimulation over the Adhipati Marma. Patient is in insomnia condition, you can keep the Shiravela over this area and you can rub it. This patient is going to night time. So this is about the Adhipati Marma. Head region and neck region covered. And Amsa Marma, meeting point of head and neck. This is the Amsa Marma. And there will be between this arms, trapezius muscle. Amsa Malaga, anyone can come. So we need junior doctors there who are coming. Yes. Just understand the location is very, very important. Meeting by the head and neck. You can also park it to the head. Neck region like this. Okay? Like this also. This is the neck region, Amsa Malaga. Meeting point. From here to 3 fingers below, this is the Amsa Malaga Marma. Okay, this is inferior angle of the scapula. From inferior angle of scapula, 3 fingers above and medial corner of the scapula. This area is Brihati Marma, a type of Siddha Marma. Whenever patient is feeling pain, the person they will do vigorous massage. Don't go for vigorous massage because this is a type of cigar. And this when we are holding like this, we can hold here, we can hold like this also. Okay, so there is a radial angle. This area is nothing but partial. Come to the Kukudara. Kukudara Marma is the sacroiliac joint. You are the partner, sacroiliac joint. And just above this area on either side of the posterior superior iliac nerves, this area is which Marma? Kukudara Marma. Okay, just below that. Nidamba Marma. Nidamba means where there is ilium is there, no? And here we can Sony Khanda, Kandayo, Kubari, Pashas. This side is ilium bone. This is the Nidamba Marma. Okay. And when you are keeping your leg, it will touch here over this center of this buttock. This is the critical marma. Okay. And come to the hands. And each one also marma location because when you are going for stimulation, when you are going for marma manipulation, marma massage, and simple massage, ED, whatever it is, concentrate over the marma. And that you can see, there you can see the right result. And Chipra Marma, Angushtan Pandi Chipra Namha, Marma is Chipra Marma. In the hand, you can palpate in your hand, other hand you can palpate. This is the Chipra Marma. Madhyama Anguli, Anubhavena, Talarudaya. This area is Talarudaya. And this one is the Kurcha Marma. Kurcha Marma. This Marma is Kurcha Marma. And this Marma is Urjashira, base of this thumb finger, not in the wrist joint. This is the Urja. I will repeat once again. This one is Shipara Marma. This one is Shipara Marma. Okay. This one is Talakadaya Marma. This is the Kurja Marma. This one is the Urjashira Marma. This one is Manibandha Marma. You got it? Because before going for stimulation, location also you have to study is very difficult. That's why anyway, everybody is knowing he studied first year and final year, even PG also. But refreshment is always needed. That's why we are refreshing. Okay. And from here to Manibandha to here 4 and another 4. Or from Kurpara to 4 angula below, center of this
Indrabasti.
Just the fourth lateral side, Indrabasti. Okay, where the radial artery is passing. Okay. And this is the Kurpara. From Kurpara, 3 angula above, Ani Marma. From Kurpara, 4.5 angula above and medially, you will get pulse. If you are keeping your hand, you can feel the pulse. This is the Bahmi or Urvi Marma. The medial epicondyle, you can see this medial epicondyle. If you are making one line, axillary fossa, you can touch. This Marma, don't press too much because you may feel weakness on your hand. In Kalari Marma, we are telling Kai Talapan Marma. If we are hitting this Marma, the entire hand will be paralyzed. In Ayurveda also we are telling Pakshaka. Okay? So this Marma is this one, Lohidat. The meeting point of shoulder and the hand is Pakshaka. So, I think I hope everyone is going that. That's why I am moving fast. Still, you want revision, we do because how much you are studying. That is other than that, what you studied, only 1 or 2 Marma, if you are practicing, then you are okay. Yes. Another time is there, you can study other time. Okay, so that's why I am repeating. Anyone is feeling difficulty, sorry, once again repeat. We'll repeat. Okay, then only Ashok sir called me and I came here and we go. Okay, there is simply coming and going, and when we study time, it's okay. So because we want to practice next day onwards. Whatever you study without any doubt in that. Okay? Any doubt is there? Still you want to revision? Yeah? Yes. Vidura Marma. Vidura Marma is in the neck region. We left this one. Vidura Marma is yes. This ear pin is there now. Here back side, here space is there. So that just below the natural process. That Marma is Vidura Marma. Vidura Marma is the vertigo condition if you are doing stimulation, press and lift if you are doing, and that will be tremendous result you can see. Okay, even person is feeling vertigo, they can just press and lift, just see up, then you can sit, walk, and you can move anywhere without any difficulty. So what we are doing in the patients directly, and you can also apply. So you get trained before giving therapy. Okay. Any doubt? Till now, this area, upper limb, Upper limb. Once again, you want revision? Yes.
Apalapa, Apastamba, Stanarvita, Stanam.
Yes, that is chest region. Yes. Before going for the chest region, once again we'll repeat. Yes, anyone can come. Anyone can come. Anyone. Come, yes. Come, ready, come, doctor, come. Because this is a discussion. You are much seniors, not the students. So we will go for discussion. I think how many of you are practicing Marma?
No one.
No one is practicing. Okay. Next, tomorrow onwards, you document it whenever you are doing. Whether it is right or wrong, whether you got result or not, that's secondary. If you got result, means again you can't do. How the patient is coming, then you take picture and videos with the consent of patient and do perfectly. And after that also you take video. So continuously before how was the patient, do the stimulation, that also you document. After the treatment, how was the patient was. Okay. Then share in your group. And if you got result, send to me. Still you are getting that. Anytime you can call me and ask me, but if I will be free, I will give. Otherwise I will be free. After that I will reply. Okay. I will not tell, I will not give reply. Definitely our aim is to propagate Ayurveda, and what we know we should teach, and what we don't know we should study from other gurus. Okay. This is just do the Marma. Show me where is Shipra. You show like this so that others can understand. Shipra.
Shikramana.
Show like this.
Taladayam.
Kurcha. No, Kurcha is here. This here. Okay? You can participate in your body. Kurcha.
Linear eminence, linear eminence.
This thinner. The base of this area. Just if you are keeping your finger, you can feel just you can feel pain. If I am pressing here, okay. So either breathe there, Duksha, Marma. Ashtanga, they explained about that. Whenever you are feeling unusual pain, that is nothing but Marma. And this is the
Manibandha.
From Manibandha. Indravasti. From Indravasti, how you measure 4 and 8 angular O or else 4 angular below. Center and side of the area. This is where radial artery is passing now. This is Marma, Indravasti. Then another Marma,
Kurparama.
Kurparama. Okay. Then another Marma.
Urvi,
There is Anu.
Yes. Mahavi.
From Kurpara, 3 angular above. This Marma is Anima.
Anima.
Another Marma. Tell. You right. Whether it is right or wrong, no problem. What are doctors? Mahavi or Purvi. Next. Where is Lohitaksha?
Kaksha, Lohitaksha.
Oh, yes, just come now. This is the axillary fossa where you are getting axillary fossa. That Marma is Lohitaksha. And this Marma is Kaksharaksha. Okay. So when doing the Kalari, we are hitting this Marma inside. Somebody is hitting, we are locking, and this is the Malladati. This lock we are doing this Marma. All this prayoga during the Marma prayoga, I told you all the stage of teaching Kalari, that is Marma prayoga. But being a practitioner, after studying this Marma simulation, everything we will teach you some self-defense and Marma prayoga also. Don't worry, okay? And so, ready? Yes. This is the Marma.
Alala, hintiri.
Amsa Marma.
Amsa Marma.
This is Amsa Marma. This Marma. Sira Marma.
Shira.
Kunati Marma. Okay. So renal angle, which Marma?
Katika Tarada.
Parsha. This is the
Tukundara.
from ilium bone, that is
Nitamba.
Nitamba. This is the when you are keeping your heel bone touch your buttocks from the buttock. This is the Katika. Clear? Okay. So you palpate in your body so that you can understand where you are feeling unusual. Okay. Neck region, head region, once again, Stabani, Avarta, because head massage will come. When patient is having headache, then you just doing your body, and after taking consent from the after your friend, you can practice in their body also. This is the Avarta, this is Apanga, this is the Fana. Okay. This Marma is
Vidura.
Okay. Then this is the
Shankar.
This is Ukshepa.
Ukshepamar.
This is
Adhipati Marma.
Adhipati Marma.
This is
Siman.
Shilagiri Devasangane.
Katika
Krikadi. And head, neck, Prishtamarma, then remaining chest and abdomen, Nabi,
Basti,
Basti, then
Nabi, Hridaya.
Nabi, Basti, then Uda. What is that? Udaramama. Then coming to the Udamarma. Udamarma, you keep your hand like this. Okay? So there, just 2 fingers below nipple, that is Tanamula. Okay? If you are palpating some cases, you may not see in the nipple, so that you can palpate the Saifuddin notch is there, no? Then this area where the Saifuddin notch is starting, you can compare, you can draw one line just below this area where the Saifuddin notch is coming, below the 2 finger nipple, that is Tanamula. 2 finger above and 2 finger medially, that is Stana Rohita. And you have to read about the Vittalakshana too, because this is Sthanamula is the Kapapurna Kostalaya, and this one is the Sthanamula, Sthana Rohita, is a type of this one also Sirama. Okay, and this one is the center of the nipple, below this the Saharic vein, everything is there. No? This Marma is Apala, and below the Saifuddin notch, this area, this Marma is Abastam. When your diaphragm is there, just you can touching, you can. In coloring Marma also, we are telling extra one is Chumaya. So I had one history, one of my father's story. My father was kept long back 5 years back. He kept his car on the roadside. Usually the people bag was there. So one person heated with one iron rod on the glass. He tried to take the bag from the car. Immediately, those neighbors are there. They catched it and taken to that house. Then father just did one prayoga of this Marma. I will not teach you because next day you may do some other persons. Because my father taught one of my relative. Next day he tried whether it is right or wrong. He started bleeding. Okay, he did only in my life. He did only one time. So Chumayan Marma, Rectanduki Marma, and these 3 Marma he did prayoga. Within 1 or 2 minutes he did. So next day he taken, he was case and taken to police station. It was continuously coughing. Then the policeman asked why. And then everything is solved. Then after that he told, I am not able to breathe properly, and clear cough was there. And next day morning he did Adani prayoga just opposite side of this one. Teach you the injuries happen in this area, how to do Adani. Okay, after studying this, and I will show you 1 or 2 videos. After that, we go for practice because we need hands-on training. Then only you can practice. Okay, this location till now, if there is doubt, once again I will repeat. This is the Hridaya, then Sthanamula, Sthana Rohita, Aphalava, Hridaya, Sthanamula, Sthana Rohita, Aphalava, and Apastha. Nabi, Basti, and Uda. This much is okay. Coming to the lower limb, this Vita. Sakanapi junction. Which one? Lohitaksha. Same. Hand. The only difference is wrist joint, elbow joint, and the shoulder joint. Ankle joint, knee joint, and the hip joint difference. From here, this is the Vitapa, Lohitaksha. This is Urvi, Sakti Marma, Urvi. Janu above from Janu, there is Ani Marma. This is Janu Marma. From below, Janu, 4 angula, there is Indra Marma. And this is the Gulfa Marma. Okay? And you can also take your leg if those who want to get studied. This is the Shipra Marma. This is the Madhya Mangula Kura. This is Talaka. And this one is the Uchishira. This Angula Madhya Shipra Marma. And Madhya Mangula Kura Parasarasa.
Taladaya Marma.
Okay? This is the Uchishira. This is the Gulfa. Okay? So we covered, I think, 1 or 7. Anything left? Okay? Clear. So I move this slides fast, then after that we go for the practicals. Thank you. Shipra Marma, all those things are like Ostaya Marma, Taladaya Marma, Uchishira Marma, Gulfa, Indravasti, Janu, Ani, Urvi, Lohitaksha, Vitapa. And you can see this video. Isn't it, doctor? It's okay, it's okay. You can see this patient. Patient came with the locking of knee. Usually locking of knee in the knee joint. What is the diagnosis? Meniscal injury. The shaking of usually in the knee joint, what will be the diagnosis? Shaking, ACL or PCL, any other ligament injuries. Okay. You know how to do the examination, anterior node test, posterior node test, Lachman test, Lachman test. You read about that. Read the anatomy, how the structure is there, and how to examine the knee joint. What are the tests explained in the textbook, and then you have to practice. Okay. And after the taking history, patient was walking. Suddenly there will be locking. Patient was not able to do the flexion, and he was not able to walk also. Then this patient, I examine like this. I go on examination. Is there any dislocation of the patella? There is nothing was there. There is an injury to the MPF, medial patellofemoral ligament, usually attached in the medial side of the patella. If there will be dislocation or subluxation of the patella, then there will be getting chance of injury to the MPF. So I examine all those things. There is no other injury to this ligaments, ACL, PCL, etc. But patient is having difficulty for the flexion of knee joint. Just I cut to my wife was holding on the thigh region, and here also one of my arm. And wife is she is also I was doctor. And just after the traction, when I was doing all this movement, I got 25% of flexion. Okay, then I came to there is not much complication, no need of going for X-ray and MRI. Then further I tried with the manipulation and everything. With all these fingers I fix it with the particular structure. There is no other structural impairment of the knee joint. Okay. So on examining all these ligaments, that's very important. Is there a posterior part, anterior part, is there injuries there in the ligament, meniscus, etc. Patient is 50% ligament flexion. Means flexion. Patient can do this movements. Okay, without any pain. So after that, there will be stiffness was there. Then I asked, where is your feeling? Then he told, anterior part nothing is there. I am feeling stiffness on the posterior part. You are getting this type of patient, no? What you will do? You will do kiri, dada, etc. Yeah? Massage. So directly we should not go for massage. Kiri. You can do after that. Okay, if person is doing kiri, you can do with the thigh muscles and the back region, other anterior part and posterior part. You should not do any hot application and vigorous massage over the affected area. Just do stimulation by doing the application of any ligament or any other lever. In the scientific system, my father used to tell me just to apply the lever as an opposite direction of the lower area. Then I was thinking, why? If just we are applying like this, and after reading Sutrasthana 18 chapter, on the level when the Utkarshana, you have to apply lever as a Utkarshana, so that this medicine content will enter inside the Ravagoba, then the Vajana action will be then usually will reduces all this action will happen. Just rub it. And just doing this Utkarshana, the Marma also will get stimulated. Okay, patient is not this much is okay. Then I changed it. I kept my finger on the posterior side. You can see here. Where is my finger? Two fingers. Okay. Now you just observe without any forceful pressure, patient is able to do the flexion. I thought this case to take MRI because initially MRI we are sending in our place. Modern doctors are very means canvassing to the patient. If you are doing for Ayurveda massage, no. If there is an injury to the ligament, the fracture is there. You should read through the or something. Whatever it is. So this case, without any difficulty, patient is doing the flexion. Then I advise this patient after patient is difficulty for walking, patient came with wheelchair. After there is reduction and bandage, patient is able to walk without any difficulty. Then I told next time we will take any injuries, how much injury is there in the ligament, we will take MRI because I need this type of cases documentation. He told, why I should take MRI? I can do flexion extension. Then he told, after 2 days bandage, I can sit, I can climb. Then why I should take MRI? No. That is what doctors are telling. That's why I am not going to for allopathy. I am coming to the Ayurveda without taking MRI and X-ray. I think that our gurukals are treating through in our area. Almost all in here in one city, 3 to 4 candy, the hotel will be there or tea shop will be there. Not like this our area. So everyone is practicing chikitse without the proper knowledge of Marma. Some people are practicing Kalani Marma, some people are practicing Ayurvedic, paramedical, this one, Vaidya. They are not knowing the basic knowledge of the diagnosis of Marma. Without blind knowledge, the gurus are doing massaging manipulation that they are doing. But being an Ayurvedic practitioner, what we should do, just examine thoroughly. For that, anatomy we should refresh and we should go for the examination and take for the patient and preparation for the manipulation, stimulation, everything. Definitely 100% you will work out. If it is not work out, then you can go for further investigation. All the cases you should not supposed to send for the X-ray. That is the strength of our power. This is my Guru Dr. Saifuddin from the SS Medical College. When we are, and I am doing the PG at that time also, whenever any type of injury is to get, we do treat through our chikitse. He is so much interested towards the surgical as well as in the, I think some gurus are knowing about him. And there's and this angle spray. I am holding here, you can notice here, my finger is in the Urchama. And another person is such a strong person, you can hold in the Gulfuma. That person will be, make it loose. After that, do the traction, on the back. Traction, both sides in the metatarsus and the calcaneus, so that we will get the space over the ankle joint, the calcaneum as well as the talus as well as in the lower end of the tibia traction and inversion. If the inversion happen like this and do the traction and do inversion, keep it in normal position, but don't go for the injury. If the grade 1 is there, you should not go for the grade 2, grade 3 ligament injury. Okay, what I am doing, any type of injury. I think one of my PG scholars she was telling about she want to do research on this, because just putting the bandage, one group, another group, manipulation and stimulation. So, what is the action of that? Definitely, the structural impairment you can correct. But the structure means the injury is there in the ligament. It will not correct by doing this manipulation. But after your manipulation, you should not increase the injury. You got what I am telling? Yes. This is the dislocation. So I explained how to keep the Shida Leva. So about this knee joint and ankle joint is much, and shoulder joint. Just I think you are interested about the shoulder joint dislocation. The dislocation is needed today? Not needed, no. Stimulation and manipulation is needed, no. Okay, this time permits we will discuss. Okay, just see here. Traction, anchana, pedana. So should I explain? You have to keep the Shida, Leva, Parishaya and everything. After that, it's okay. Traction, external rotation, adduction, medial rotation. No need of doing all those things. Just the traction, anchana, pedana. If you are doing the Marma Prayoga over the Kurupara Marma and the Manipura Marma, just hold it traction. It will be alright. And this is another, you can see here actually for the branch angle, you can see here. Another shoulder is the dislocation, our traditional method. Patient hand we are keeping this between the knee joint, just doing the traction and lifting. Anytime we will get. In the older days, my father used to call me night time 12 o'clock and 2 o'clock. This type of patient is coming, you just hold with this wrist joint, Kurupara Marma. Then I told him, I did not tell to my father. If I told means, Kada Mugito. I will tell to my mother, then mother will tell, oh, you just tell to your father. I am not calling you, no. But older days, I was seeing this type of patient in the night time, daytime, every time. I got interested, then I studied PMS. Okay, then I studied PG. Then I still am pursuing the PhD to do some researches on this. And being a practitioner, you try to document this case and try to do this researches on this. Okay, just traction, anchana, pedana. ಸಂಕ್ಷೇಪಣ ಉನ್ನತ ಕಾಪಿಟೆ ಆಂಚರ ನಿಕ್ಷಿಪ್ತಂ ಅಧೋಗತಂ ಚೂಪರಿವರ್ತೆ ತೋಳದಿಂದ ಸಂಲಿಪ್ತ. This one is ಅಧೋಗತಂ ಚೂಪರಿವರ್ತೆ. Okay. Simple method. It came in Alas when I was doing practicing there. entire full round was the students, and I think this student is physiotherapy. Our students, final year students, taken this student to our Ayurvedic hospital. Okay, answer. This is a type of anterior levoid, subclenoid, and subcortical infraclavicular. Anterior there are 3 types. This is subclenoid type. So it is just anterior traction and adovadam chudriva. That will be correct. After that, it will be, that is doing stimulation. After that, this is Marma massage and doing the stimulation over the this one front side as well as back side. You can put the even after the fracture management, even after the dislocation management. You can this is another case. This is anteriorly infraclavicular type. This is Marma prayoga I am doing in the Kupara Marma. Anjana doing the Anjana type, I am doing the Kupara Marma application. He was crying like anything. The sound was able to hear, means you could hear that how much he is crying. The same technique I tried, but it was not working because of this muscle pulling and strengthening. The time video just I tried to divert his mind after giving water, but he is concentrating more. It was not working, then I tried a second step. Thank you. Yes, yes. I kept the patient hand in my axilla, then I mentioned it. It will be alright. After that, we did sustainable. Okay, this is a case in the lumbar, in the manipulation, just both sides we are holding. Just walking, slipping, there is no history of fall. There is no other fracture, not going for any X-ray. Just we did examination of the wetness and everything as a test. It was patient is not able to bend this much. After the manipulation, patient is able to bend forward without any difficulty. Okay. And any type of doubt is there, you can keep my number. You can WhatsApp also, and we can discuss. Now we will go for the demonstration and hands-on. Okay? Getting more? No. Yes. Thank you. Let's stop this presentation. We will go for the demonstration and hands-on training. Yes, I need models. So among yourself you come, then feel it how it is. Okay, come. First we will start with the cervical. And after demonstration, you have to take your those who are sitting your neighbor and do gently. Don't go for vigorous manipulation and vigorous stimulation. It will make painful. Okay. Once you are doing, you will get confidence. Next day, definitely you should work. You do, then it will work out in your practice. And once you started this practice, next day they will tell, oh Marma, these people are doing Marma, Ayurvedic practice. And you should tell something, Marma, chikitse is there. Don't tell us a specialist because you can tell once you are expert, but Marma chikitse is there. I used to tell my students, if you are telling you are knowing this, all this Marma, the coloring people want you to do, they will do some Marma. Then next time you are not able to do other work, we have to try to calculate. Okay, come.
And students.
Yes. Come.